Fibromyalgia, FM, is like the insidious ninja of chronic pain, sneaking into your muscles and joints and causing a symphony of pain all over your body. But it's not just about the pain. FM likes to bring along its unpleasant sidekicks: fatigue, brain fog, mood swings, and a whole host of other annoying symptoms that keep you on your toes. No one really knows where FM comes from or what he is up to. It's like a mystery novel with missing chapters. But here's the interesting thing: for all the drama and discomfort, there is no evidence of inflammation in these troublesome tissues. It's like FM is a master of disguise, making your muscles scream without leaving a trace of inflammation behind. FM is a common condition characterized by chronic pain, especially in women between the ages of 20 and 55. The prevalence is around 2 to 3% and increases with age. Think of fibromyalgia as a complex puzzle, where the puzzle pieces represent the various factors that contribute to the development of the disease. Each puzzle piece represents a different physical or emotional stressor, such as infections, trauma, or other triggers. Think of the body's perception of pain as a volume knob on a sound system. Because this switch is on in people with FM, even the smallest stimuli feel more intense and painful. Like a malfunctioning sound system that amplifies every sound, making even the softest whispers feel loud and overwhelming. Furthermore, endogenous analgesic systems in individuals with FM can be likened to a security system that is not functioning optimally. Just as a security system protects a home, the body has its own natural pain-relieving mechanisms. However, in FM, these systems may be missing or may not function effectively, leaving individuals more vulnerable to pain. The main symptoms of FM are widespread pain, fatigue, and sleep disturbances that have been present for at least 3 months and cannot be explained by any other medical condition. Chronic pain that spreads throughout the body characterizes fibromyalgia. It typically affects multiple areas, including the head, arms, chest, abdomen, legs, and back. The pain is primarily felt in the muscles. Some patients may also experience joint pain and swelling, although there is no inflammation on examination. People with fibromyalgia often describe the pain as aching all over. People with FM experience moderate to severe persistent fatigue. This fatigue is not relieved by rest and can be exacerbated by seemingly minor activities. People with FM often wake up feeling stiff in the morning. This morning stiffness can be similar to that experienced in other rheumatic diseases such as rheumatoid arthritis or polymyalgia rheumatica. Despite getting a seemingly adequate amount of sleep, 8 to 10 hours, people with FM often report feeling unrest when they wake up. They may describe a feeling of heaviness or feeling like they have been hit by a truck in the morning. FM patients often experience sleep disturbances. They tend to sleep lightly and often wake up early in the morning. Cognitive impairments are common among most individuals with fibromyalgia and are often referred to as fibrofog. Patients often report difficulties with attention and have difficulty performing tasks that require rapid shifts in thinking. Depression and/or anxiety is present in 30 to 50% of patients at the time of diagnosis. Headaches are present in more than 50% of patients with FM and include migraine and tension types. Patients often also report paresthesias such as numbness, tingling, burning, or crawling sensations, especially in both arms and both legs. Among gastrointestinal syndromes, IBS is often correlated with fibromyalgia. Gastroesophageal reflux disease is more common in patients with fibromyalgia than in the general population. Patients may complain of dry eyes, shortness of breath, difficulty swallowing, and palpitations. Imagine a concert hall where the brain is the conductor and pain signals are the musicians playing their instruments. In fibromyalgia, there is a problem with the way the conductor processes the music, leading to a distorted symphony. First, the brain becomes hypersensitive, like musicians who are hypersensitive to even the slightest touch of their instruments. This hypersensitivity causes patients to perceive pain more intensely than usual, as if every note played by musicians is amplified. Various abnormalities contribute to this distorted symphony. High levels of excitatory neurotransmitters, glutamate and substance P, act like enthusiastic musicians, playing their instruments with excessive energy and contributing to the amplification of pain signals. The reduced levels of serotonin and norepinephrine in the antinociceptive pathways descending in the spinal cord can be likened to a lack of skilled musicians who would normally help regulate pain signals. Their absence hinders the orchestra's ability to control and suppress pain. The prolonged increase in pain sensations is like a continuous crescendo in which the volume of pain signals remains high over a long period of time and causes persistent discomfort. Dopamine dysregulation can be likened to musicians struggling to find the right rhythm or tempo, leading to irregular and inconsistent pain processing. The change in the activity of endogenous opioids in the brain is similar to how musicians who play their instruments out of tune affect the brain's natural pain-relieving mechanisms. Fibromyalgia should be suspected in patients with chronic pain lasting at least 3 months without any other identified cause. The diagnosis of FM is based on symptoms. Fibromyalgia is typically diagnosed based on the following factors: widespread pain in more than one area, usually moderate to severe sleep disturbances or fatigue that persists for at least 3 months. It is important to note that additional symptoms may also be present. Despite tenderness in multiple areas, individuals with FM do not show joint swelling or other signs of inflammation during physical examination. Diagnostic evaluation includes a thorough history and physical examination with limited laboratory tests to exclude other conditions. American College of Rheumatology Preliminary Diagnostic Criteria for Fibromyalgia and Measurement of Symptom Severity. A patient fulfills the diagnostic criteria for fibromyalgia if the following 3 conditions are met. Widespread pain index is 7 and symptom severity scale score is 5, or WPI equals 3 to 6, and SS scale score of 9. Symptomatology has been present at a similar level for at least 3 months. The patient does not demonstrate any other disorder that would otherwise explain the pain. The WPI is a measure of the number of painful body sites from a defined list of 19 sites. The SS score includes an estimate of the degree of fatigue, waking without rest and cognitive symptoms, and the number of somatic symptoms in general. Patient education is very important for people with fibromyalgia. Patients should be reassured that fibromyalgia is a real disease. Stress and mood disorders play an important role, so relaxation techniques and stress reduction programs can be beneficial. Depression and anxiety are common and patients should seek appropriate treatment. Good sleep hygiene is essential and addressing sleep disturbances is important for symptom management. Exercise is recommended for fibromyalgia patients. Cardiovascular fitness training can help relieve pain and improve sleep. Optimal training includes 30 minutes of aerobic exercise 3 times a week, aiming for a target heart rate. For most fibromyalgia patients, non-pharmacological measures should be continued alongside the use of medication. Some patients may respond well to non-pharmacological measures alone. Antidepressants include tricyclic drugs such as amitriptyline and other selective serotonin reuptake inhibitors and norepinephrine reuptake inhibitors, including duloxetine and milnacipran. Cyclobenzaprine, a tricyclic drug, has also been found to be effective in patients with fibromyalgia. Useful anticonvulsants include gabapentin and pregabalin. FDA-approved drugs for the treatment of fibromyalgia are pregabalin, duloxetine, and milnacipran. Tricyclic antidepressants are usually the first treatment option. For patients who have an inadequate response or intolerance to tricyclic antidepressants, an SNRI or anticonvulsant may be considered. An SNRI or anticonvulsant is recommended for patients with severe fatigue, depression, or sleep disturbance.